Next question. Would you make the independent governance of the county healthcare system permanent? Why or why not? And this question is for Alderman Preckwinkle.
Thank you. I'm the only Democratic candidate who said unequivocally that I will make permanent the independent governance of our healthcare system. The only one. And you have to understand, other candidates will say, well, we need to review this after the experimental 3-year term expires, whatever. We do get to review it as a county government because they have to come to us with their budget every year. So there is already in the present legislation, and hopefully if we can make it permanent, there's an opportunity for the county to provide oversight for independent governance. But I really think that independent governance is critical to the quality of health care that we receive. We can't fill professional health care positions with precinct workers and expect to have a good system. You know, unfortunately, the county at all levels has been seen as a patronage symbol, a place to put your precinct captains. And it's got to be, the county has to be well-run, efficiently run, and professionally run. And starting with our healthcare system, where 1 out of every 3 of our dollars is spent, a third of the county budget, roughly, is healthcare. So this is really critical. And I strongly support Bill Foley and the Independent Governing Board, and I think we need to make permanent. Thank you. We need to make permanent the governing board.
Thank you.
Thank you. Yes, I would make an independent governance of the health and hospital system permanent, because I believe that because the health and hospital system represents almost a third of the budget, about $800 million of a $3.3 billion budget, we need to have healthcare professionals, financial people, even attorneys running that health and hospital system. Also, I just believe that it's very important that we do have a review of the effectiveness of how the board has run so far. And then after that review, we then make it permanent. Anytime you start something, there are always things that need to be tweaked. And so I want to have a review and evaluation, but then ensure that we have a permanent, independent oversight of our health and hospital system. But let me just say this. I don't agree with them wanting to take inpatient care from Oak Forest Hospital. I do not agree with that. I do not agree with them wanting to fire all of these nurses, because we already have a small nurse to patient ratio.
Independent healthcare board with one cadre, and that's the fact that there's a review of what they have done. I think it's important to the taxpayers of this region that they're accountable for what they do. And my colleague, or my opponent here, says that she says you can evaluate that through the budget process. I'm wondering what my opponent's going to say when they decide to close Oak Forest and Providence Hospital. How are you going to make that evaluation through the budget process? But there's been a track record and a history with regards to an independent healthcare board here in Cook County. Going back to 1969, when the county healthcare system was in jeopardy of losing their accreditation, there was an independent healthcare board that was developed. And they did very well up until 1975, when the doctors went on strike, and in 1977, when the nurses went on strike. And then after that, they ended up with an $80 million deficit, then it was reverted back to the county board. We just had and read about an independent board at the University of Illinois. In the Tribune ran a months-long worth of series with regards to what went on there and how people were being paid.
Your sentence.
People were being paid favoritism for being accepted into the university. Now that was an independent board. Who were they accountable to?
Thank you, Mr.
Nobody.
O'Brien. Your time is up.